everyone. Welcome to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. This is your host, Tara Martini, along with Becky McNatten. We are so happy to have you listening as we live and share stories of mental health.
Tara, today we're welcoming a special guest.
So excited. We love special guests.
Melissa Claar is on our show today. Welcome, Melissa. We're happy to have you.
Thank you. I'm happy to be here.
You are a pediatric nurse practitioner, Melissa, and you focus on integrative health and medicine. And in the mental health realm, we talk a lot about the mind-body connection and how physical health influences mental health. And actually, many of our shows have also been on this mind-body connection. But the term integrative health or holistic medicine can be really confusing to people and challenging to understand. So we wanted to dedicate a whole show today to this idea of mind-body connection, and would love for you to tell us about your approach and beliefs around what integrative health is.
Yeah, that's a great question. So, integrative health itself, I would say, is sort of employing interventions that are holistic and then maybe are not considered mainstream. Integrative medicine is sort of still integrative health. It's more of a subspecialty practice. So like you might go see a dermatologist for a skin issue.
Okay.
You might see a neurologist for, headaches, for instance. So you might see an integrative medicine practitioner as a subspecialty. And our role is really to integrate, hence the name, evidence-based holistic strategies into modern conventional care. So if you think about it, modern conventional care or medicine plays a crucial role, and especially when it comes to like acute medical conditions. But like everything, there's opportunity for improvement. Our healthcare system really has some flaws, and this is where integrative medicine can be helpful, because it may not be that a pill for every ill is necessarily the right or only thing that we can do to support people's health and well-being.
Yeah, and so often I love your phrase, pill for every ill.
Yes, I was going to say,
it's a very
is worth repeating.
Medicine.
I was like, if Becky doesn't say it, I'm going to.
Already my takeaway.
Yep, love it.
That and part of what we've talked about in this show is so much of traditional medicine in a kind of the Western approach is that pill for every ill focuses on symptoms and not necessarily root causes. And so I hear you saying that could be an aspect of treatment, but integrative health is this idea of seeing more whole person-like.
Totally. Mind, body, spirit, community. Whole people are complex, right? It's not just your symptom. It's not just your disease diagnosis that you carry. It's so much more than that. And really, integrative gives people the best of both worlds. It's not an instead of, like an alternative to conventional care, right? It's let's look at all the various things that we could potentially do to help you.
Yeah. And that's a word that's been used a lot, is alternate or alternative medicine. But I love that you say it isn't instead of.
Yeah, so that's it's older terminology. And I think that's part of why we've had to work really hard in our industry to gain momentum and approval of conventional practitioners. I used to be one of those, by the way, because it was almost you had two people kind of fighting for what is the right thing to do. And we're not really doing complementary alternative medicine anymore. I mean, there are still some practitioners likely, but really what integrative medicine does is harnesses the evidence. What's the safety, what's the efficacy out there based on studies, and how do we infuse those into, and it may result in less medication use. Right. Or it may prevent some issues that then would require medications.
Right.
But it's not a blanket statement.
And it's that idea of what you said a few moments ago of it's not just only one thing. It's that whole thing. It's like in schools where the education system used to be the child academically, and now it's the whole child. So similar to that. It just takes a while for people to get there.
Right. Fascinating topic. And we're going to explore all of it. Right now, we're going to take a short commercial break, but stay tuned as we dig deeper into integrative health, what it is and what it means. Thank you for listening to Feels Out Loud. We will be back in just a moment.
All you got to do now. Nothing to lose. In a world full of strangers, you don't know who's right. All you see is danger, trying to find what you lost.
Welcome back to Feels Out Loud, brought to you by Becoming Together Therapy and Wellness. I'm Tara Martini, along with Becky McNatten. Let's dive right back into our discussion on integrative health with our special guest, the fabulous Melissa Claar.
So, Tara and I love a good origin story, Melissa, and I would love to hear about what makes you passionate about integrative health and just what was your road to getting to the place where you are today?
Yeah, I mean, I think for me personally, I was introduced to what I would say is a modality within integrative medicine, which was yoga.
Okay.
In my early career, back in 2003, a nurse colleague of mine said, "Hey, join me," and I was pretty blown away by how good I felt afterwards. Not just simply from moving my body, but slowing down, pairing my breath to movement. Starting to engage in mindfulness, which I didn't really know what is that.
Well, and then it wasn't a thing, right? It wasn't that hot
We weren't really
name
even
of
using the word.
mindfulness.
Yeah.
Absolutely.
Right.
Yeah. And so that was my little introduction,
Okay.
which then led me to learning about mindfulness and meditation. And it was a game changer, right? Like for me personally, I tend to be a high overachieving, a little more anxious. And I realized that these modalities really are empowering. They put so much control back to me in an effort to be able to feel like I can regulate and manage all sorts of avenues of my health and well-being. And so it's sort of like back to the basics, these simple things.
Totally get it.
But really powerful. And integrative medicine by nature is partnership based. My job is to understand what is the person that I'm working with, who are they, what's the deeper essence of them,
Sure.
what's important health wise, and then we work on it together. And so that is really where I feel.
Well, I love hearing
fueled.
about, first, it's personal for you. It's very personal. And so much of our passion comes from those spaces of personal that we have to slow down in that stillness to even realize what is the messaging that our body is sending us. And so that you felt that, and welcome to the club on the anxious side of high performers.
Yeah, I mean,
I live
there
there
might
too.
be 3 people in the room.
And there's only 3 people.
Yep.
I would guess there's a few listeners who are also chuckling
Yes.
right now. And that, so you felt it and then noticed how much difference comes from not necessarily suppressing the dialogue with our body, which is sometimes what a pill does.
Right.
It's looking to tune into it.
Absolutely.
In a time when a lot of people, like we said, I would imagine, and I wanted to follow up on a question where you said in 2003, was it difficult to find things on mindfulness when it wasn't a hot topic? So when you were researching it, was it difficult back then to find things?
I think, it's really interesting that you say that. So in 2003 is when I graduated as a registered nurse, and then I practiced, and I went back to school to become a nurse practitioner. And the bulk of my nurse practitioner practice has been in conventional modern medicine. So I've been an NP for 17 years, and I just pivoted into integrative medicine 3 years ago.
Okay.
Oh, wow.
And largely because I started to see some of the gaps of our U.S. healthcare system. And also, I'm midlife. And so, you start to think a little bit about, like, am I living my values? How am I going to live my values? And so it was a little bit of like following my heart, my intuition.
Yeah.
And then I went back to school and did a 2-year integrative medicine fellowship and shifted and pivoted. And so really, I think I wasn't researching it at the time. I was just experiencing it and finding that it was a golden nugget for me.
Which experience is everything, right? What a beautiful way to discover something through experience. And like you said, it also is shocking to your point about, you said midlife, and then I followed, my heart and listened to myself. And we've talked about that previously in other episodes about why does it take us so long to listen to that voice inside of us and to match our values with.
Well said.
And it's so great that you said that, because I heard you talk about kind of almost the mind-body, not only the mind-body connection, but mind-body attunement. And how do you listen? How do you pay attention on purpose and learn from that? And I think the beauty is I look at these children that I'm working with in my clinic and I think, oh, what would have happened if I had learned that
Yes.
when I was 7?
For sure.
You know,
Yes.
and so it hopefully less and less individuals are waiting until midlife to really start
Yeah.
to tune into that, as you said.
Well, on that, tell us what the mind-body connection is.
Yeah, so I think, I always say, well, what is the mind, right? Our mind is our thoughts, our feelings, emotions, kind of how we learn, memories, lived experiences. And the longer I'm in integrative medicine, the more I realize people have had some really difficult lived experiences.
Yeah.
What's the body? Right? It's the structure and the function or dysfunction of our organs or our body systems. It's also a step further than that. It is the sensations that we experience. It could be an itch. It could be chronic pain. It could be you feel your heart fluttering,
Okay.
right? So these two things are constantly interacting and communicating, almost, and we may not even realize it.
Right.
So I like to say they influence one another bidirectionally, which means, I'll give you an example. Today I pulled into this parking lot, a little bit nervous, a little more than
Yeah.
a little,
Yeah.
nervous, right, to come on the show.
Yeah.
Right. Something new.
Yeah, and so that's my mind. And what did I feel? I felt my heart kind of pitter-pattering a little faster. My breathing was a little more shallow, maybe a little shaky.
Yeah.
That was showing up in my physical body. That's the mind impacting the body. Reverse is true too, right?
Great example. I love the way that you highlight how they interact and impact each other. We might have a bodily sensation that also causes certain thoughts or feels.
Absolutely. Or if you're perhaps living with a chronic condition and you experience a flare in your physical body, that is undoubtedly going to impact your mood.
Sure. Yes.
Right? And
yes.
if you're experiencing higher stress things compared to the average day, it may actually trigger a physical flare. And so how, really, honestly, the mind and the body connection, the mind and the body are one. And we can use that to our advantage by tuning in, as we said earlier.
Well, and it's important to note, because I think we easily forget that, just like you had stated about your experience just this morning, but it's important to recognize that communication between the two in the relationship is a constant. It is happening all the time, whether we know it or not, whether we are sleeping or we are awake.
Absolutely.
And so how has it taken so long, right, for us to focus on this something where this is the relationship that has been with us the longest, and it's constant, so let's focus on it.
And it's giving us information.
It
right?
is.
These are cues. And so
It's caring for us.
Absolutely. I mean, when I noticed that, I put my, kind of preparation notes aside and I turned on some meditation music and I literally focused on my breathing and watched the leaves dance on the windy trees,
Yeah.
And I could literally feel my parasympathetic relaxation response kind of powering up.
Yeah.
Which is so these are messages. This is very profound in a subtle way.
Yeah.
And if you pay attention, you'll be able to use it to your advantage.
So you mentioned maybe a minute ago physical health and how we would notice that in our mental health. Say more to us about how physical health impacts mental health.
Well, physical health definitely impacts mental health in a wide variety of ways. Let's just take, for instance, food, right? Nutrition, which impacts our physical health. If we are eating high quality foods, right, it can promote cardiovascular health. It can help with cholesterol metabolism and glycemic control. But it can do much more than that. It can support our gut. And then what does the optimal gut health support? It supports the optimal communication of and production and storage of our neurotransmitters, right? Those neurotransmitters, those chemical messengers that help with mood regulation and cognition. So food is just one example. Nutrition is just one example of supporting your physical health in addition to your mental health. They're really inseparable.
Yeah.
Well, and it's something that is such a vital part of every day. Food.
Absolutely.
Yep.
Yeah.
So when looking at how does integrative health work with other healthcare professionals? As in how,
So I would say side by side.
Okay.
It's a collaboration. The goal is not to be a competition, right? The goal is really to be collectively working for the client's greater good. So it may be if a provider in gastroenterology refers to me, I am going to review their records. I'm going to even maybe consult with them before I start something like an herbal remedy.
Okay.
To open up those lines of communication. I might, if it is that I'm seeing somebody for anxiety, for instance, who's been referred by their therapist, I may obtain a release of information and have a conversation with that therapist. And it doesn't have to be on all of the deep work that people are doing, but what are you working on? These are some of my ideas. How do you feel that would fit with this potential client? And how do we make sure that we are coordinating care to set this individual up for the best success?
Okay. So now off of that, you said there's that coordination of care, but then as far as if you look at it as a black and white appointment, how does it look similar or different to, a typical medical appointment?
Yeah. So I would say I'll highlight the big differences. Okay. One of the main differences is that integrative medicine is very much like therapy, founded on a therapeutic relationship. So we have longer appointment times.
Okay.
Because it's very important to understand who you are working with, what's important to them.
So important.
Yeah. And really, what are their health goals? I would say, quite honestly, 7, 8 out of 10 times, the reason they were referred and what the health goals of the individual do not match.
Really?
Wow.
So that's why I ask. We talk about what's going on in the mind, what's going on in the body, what are the things that are bothering you, like help with. And oftentimes it's not, the thing that they were referred for.
Why do you think that is?
That's a good question. I wonder if we're not listening or paying attention, because much of my work is almost like meditation, right? I am noticing, noticing. I'm curious. I'm asking questions. I'm meeting people where they're at. I'm not telling them what to do. Nobody wants to be told what to do. Right. So that highlights another difference is we're not authoritative. We're not directive. I get to know you. I make recommendations based on my expertise. You tell me yes, no, maybe so. Okay. And we go the direction that makes sense to you. So a lot of motivational interviewing is employed, right? Okay. Because in order for change to be real, you need to figure out what is driving the person, what is important to them,
And I would guess then that sounds sort of different than maybe a traditional medical appointment that focuses on tell me what the symptoms are right now. Do you run into people who don't even know what their health goals are?
Yeah, and I don't actually necessarily, remember I work in pediatrics, so
yes.
I don't, say, what are your health goals, right? Most of the time
the little kid's like, what?
But, when I say, what's bothering you, whether it's in your mind or your body or both, because we've now spent some time talking about the mind and the body, so they get it, and usually when we're meeting, it's a dialogue. It's not me just talking. It's
right.
like,
that makes
it's
sense.
Interactive, it's playful. And then... we go from there.
That makes so much sense. When
it does.
We mentioned at the beginning of this episode, this mind-body connection. We talked about it a few minutes ago. What are ways that if listeners are thinking about the mind-body connection right now, how can we tune into it? What are ways we can practice how to build that for ourselves? Because I don't know that we necessarily learn from people how to do it.
Yeah, I think, this is a tricky question because you really only need yourself, but sometimes you need a coach, right? You need somebody to help you, number one, understand and learn what these tools are. And there are a plethora of mind-body tools, right? Things like progressive muscle relaxation, autogenic training, breathing exercises, clinical self-hypnosis. I mean, there are many, 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 many options. And so finding the one that's right for you is really important. And so I would actually say working with somebody that either does somatic therapy or is an integrative, holistic practitioner to understand what might resonate for you, what might be right for you. Because I'll give you an example. I saw a youngster recently and we were doing a meditation, and at the end I always check in. We do a debrief. How was that for you? What did you notice?
I love that.
Was there things you liked? Were there things you didn't like? And this particular person was like, it's so-so. It was too calming. That is really important information to know for that person, right? They need to move.
Yes.
We can't just sit when we're doing something like mindfulness. And so maybe you incorporate mindful movement. So I think it's really individualized is the bottom line.
But it's also so important. It's a wonderful thing that there is a surplus of modalities and exercises out there. But what a daunting thing for an individual person to have to explore on their own.
Yeah.
Where that coach piece would be so important, because I would assume that if that individual child was on their own and tried that one mindfulness exercise with the breathing and was like, that was too calming, that may have ended their surge.
Absolutely. Yeah.
Because we get frustrated. We think that's too difficult. But then for you to say, oh, we're not stopping there. Let's keep exploring and let's find the right fit for you.
And it just might not be the right fit for you at this moment in time.
Exactly. Exactly.
Really good point that we evolve and change as people. And so in that attunement to self or listening to self, that we keep growing and changing. So being flexible with ourselves and how we listen to the messages.
Yeah. One simple thing people could do, if they didn't have the bandwidth to try and find somebody to help work alongside them, is simply observe, right? Without attachment. If you're experiencing an emotion or, you're having feelings around the emotion or thoughts, pause. What's happening in your physical body? What physical sensations are you noticing? And vice versa, too. If you're experiencing pain or chest discomfort or heaviness or a stomach ache or, pulsating headache, pause. What has been going on in your life? What emotions, thoughts, things are going on? How do those things connect, the physical sensations and the emotions and thoughts? Oftentimes they connect.
Yeah. Well, what a great tip, because I think about times as a clinician, I've said to people, pick a minute a day, just set a timer for some time and just notice your breathing without an intention to change it at all. Just notice it. And what messaging is that sending you? Is it rapid breathing in that moment? Does that tell you something about how you're feeling? But without even going in and a thought of, I'm going to calm down, I'm just going to notice. So I love that idea of we can challenge ourselves to do that.
And it is so easy to do. And it's also, I think, so important to realize you can do that when things are good. I recently was working with a client.
Great point.
It is.
And it was that idea of, wow, this stressful time has passed. And we just took time to, let's just stop and go through I just want you to breathe and then just think about how your body feels. And it was that idea of noticing the difference between our body during stressful times and our bodies learning to rest. And so because
Great point.
How can you know what your body is like in a heightened state if you don't know what it's like in a relaxed state? And I think it's important to recognize too.
Yeah, absolutely. The difference between tension and relaxation.
Yes.
And even, as a matter of fact, often when I'm teaching mind-body skills and then we're learning about them and we're practicing them, the homework is not go use that when you're having a panic episode.
Right.
By the way, I like the word episode versus attack because it infers there's a beginning, a middle, and there will be an end.
Everything's temporary.
Yes. And so, it's really about using those tools at times where it's pretty easy, right? You're not going to go to a tournament and, play in a basketball tournament. If you've never played basketball, you're going to join a team. You're going to practice some dribbling skills, right? So practice when the stakes are low and you're building or you're exercising your mind-body attunement and skill development so you can use them when they really matter.
That makes so much sense to me. Would love to hear more about what benefits you've seen in practicing from an integrated model. How have you seen it help people?
Oh, goodness. The answer is endlessly.
Yes. How much time do we have?
Yeah, right. But I think, I have seen it be so helpful in a lot of different conditions. Probably some of my favorite, honestly, are the ones that are a little bit mind-blowing. So, for instance, bedwetting, lots of later adolescent individuals who are still experiencing bedwetting.
Yeah.
And they come, of course you have to do your due diligence from a conventional standpoint and make sure that there's not something organically going on, right? Once we've done that, then you see an integrative medicine practitioner, you may learn something like clinical self-hypnosis, which is simply a focused state of attention. We all come in and out of these states all the time. We're more internally absorbed. We're aware of what's happening externally. We're just not paying as close of attention to it. But we're using that skill. We're inviting and learning that tool on purpose in an effort to have a therapeutic goal to stay dry at night.
Okay.
And it's based upon the innate self-heal. We all have the ability to help ourselves. We just may not, in our thinking critical mind, know exactly what that is. But we know within ourselves. And so you have a clinician help support you in that. And you learn the tool, and you help yourself. So I'm in the business of helping people help themselves.
Well, how empowering.
Yeah, exactly.
How empowering.
And so that's one of my favorite ones, things like disorder of the gut-brain interaction, where people have chronic abdominal pain or nausea. And, of course, we've gone through all of the GI workup, and there's not a digestive reason, right? We don't have inflammatory bowel disease or something else going on.
Something structural.
Yeah. Right. But then this is a mind-body. This is an autonomic nervous system issue. It's very real. But there are different ways to help it. And so my favorite is, when I see, teenagers coming in with chronic belly pain or nausea that's really interfering with life. And they learn tools and it goes away. And then they say, I've taken 5 different medications and none of them have helped like this, And so it's really fascinating because the reality is, even if it doesn't 100% resolve, these tools are things you are going to use for other reasons in life for the rest of your life.
That is fascinating.
Wow. Yeah. Wow.
You mention gut health a lot. For listeners who are, tuning in and first are like, I don't know what that even is.
Yeah. It's a pretty buzzword, isn't it?
It's like, mindfulness.
Tell us what it is and how it impacts health, and then maybe specifically mental health.
Yeah, so gut health is just like by definition the balance of and functionality of the digestive system.
Okay.
And within that, there are ways to support. It also has many different roles, right? Like it supports immune function and inflammatory responses, et cetera, et cetera. The processing of food or the nourishment that we have so that our bodies can use it. Mm-hmm. But when you're thinking about gut health specific to mental health, within the gut, so particularly the large intestine, we have this ecosystem of microbes. We call it the microbiota. And it's things like parasites and bacteria and yeast. We have trillions of them.
Wow.
We actually have more of them than we have of our own human cells, believe it or not.
Really?
Living on us and within us. So it's like a symbiotic relationship.
Well, there goes we're mind blowing. Yep.
Yeah.
Yep.
And so there are things you can do, stress management and using food, that can support a very diverse and plentiful, healthy set of gut bugs, as we call them. And these gut bugs are really important because we have our central nervous system, so our brain and our spinal cord. We have our enteric or our digestive system, right? And then the enteric system actually has its very own nervous system. We call it the enteric. So it's like the second brain, the enteric nervous system.
Did not know that.
We
love being students.
I love being a student.
Most of our neurotransmitters actually are produced in the gut, right? 75% of them.
Incredible.
Almost 90% of serotonin. And, right, that's what many of our medications are targeting.
Yes.
When it comes to anxiety and or depression. And so there are nutritional ways that you can support the gut. I'll just give you a couple quick tips. Whole foods as best as possible. Limiting ultra-processed, right, as best as possible. Lots of plants. Plant heavy. Okay. Which entails lots of fiber. And then, those are kind of some of the big things. And then pre and probiotics. Prebiotics are those non-living organisms that feed the gut bugs. Bananas, oats, garlic, onions, leeks, etc. And then the probiotics, which are bacteria or the gut bugs, but we consume them through food, typically fermented food, kimchi, kefir.
Okay.
Miso.
Yogurt, maybe.
Yogurt.
Yep.
Right. Yeah.
Okay.
Yeah.
That's so interesting. Certainly as people who work in the mental health field all the time, we hear people who have a paralleled experience of some sort of physicality when they're coming in for therapy. And often gut-related physical experiences.
Absolutely.
And so it's amazing and also not shocking at the same time, but I'm sitting with, oh goodness, this is incredible on how much they're related. And that so much of our mental health chemicals that are traveling through our bodies all the time are coming from that space. We don't think about that enough.
No, we don't.
Yeah. You know, honestly, that's where a lot of these phrases like my stomach dropped or, you know, I had a gut feeling, like a lot of these sayings come from it because it really is the interplay between these three systems, our central nervous system, our enteric system, and our enteric nervous system. And so gut health promotes optimal communication. You're texting and calling the right person at the right time and they're receiving the messages, right?
Wow. Now, let's say you're a listener, because I know for a lot of people, myself included, when you listed off, like, here are the food items we should eat and things in the diet, my first thought was my child will never eat all of those things. And for a lot of people, they just think the cost.
Yeah,
right?
absolutely.
Wait, you want me on this and this and this, and then eating, you know, these things.
Well, and you mostly work with kids.
Right.
Right.
So
if
good
you
point.
could just provide, like, hey, if you're going to spend your money, or what are 1 to 3 things if you're like, hey, you don't have to cover this whole thing if it's not realistic, but what are some really big heavy hitters to make it more realistic for some listeners?
And again, this is where being with a clinician is really helpful because they can understand there's so much to nutrition, right? You already hit on accessibility and affordability, but
Which
things
is
like,
huge.
Huge. Other things, cultural and religious beliefs also play an important role. Our food story, right? Like, what did we grow up as parents with in terms of nutrition? So this is a very broad topic. But if I were to try to boil it down, let's say,
Which I know is really a huge challenge. I'm sorry, but
no, I think, right, parents get to choose what and when food is offered. And really the child gets to kind of choose on their plate how much and what on that plate they eat. So trying to avoid food battles, right, is one. And
So
that's
stressful.
tricky, having a 15 and a half, nearly 16-year-old, really. I see a lot of junk food in my home that I am cringing at. And it's important to have some self-agency. And so I think, you know, giving options, continuing to offer those options, you know, introduce them to a wide variety of plants. You can hide them too, to be honest, in smoothies or soups or stews or, you know, casseroles or lasagna.
There's a whole cookbook on it, actually.
Oh, that's
of
amazing.
How to hide healthy foods.
Great. I should find that cookbook because that's a great idea.
I believe it was written by Seinfeld's wife.
Oh, interesting.
Yeah, I have it.
You learn something new every day, or many new things.
But it's
every day.
fascinating.
Yeah.
It's like tricking our children into eating healthy.
Yeah. And I think the other things that I would say are really important is food should not be a stressor. And when we hyperfixate on it, it's counterproductive. You know, so I sort of try to do an 80-20 rule.
That makes sense.
80% of the time I'm trying to make healthier food choices, and 20% of the time I give myself a pass. You know,
You do? Okay.
I had Popeyes the other night because it was our last day of school for our son, and that's what he wanted. And I thought, but I wanted to, I really wanted to meet him where he was at and celebrate with him.
And so you kind of keep that ratio for both you and your child, or your whole family, kind of.
I aim to.
Yeah.
Yeah.
Well, honey, that's all we're trying to do is for it.
Straight up mediocrity.
Yeah.
Straight up mediocrity.
Right.
Well, okay, so an offshoot or a different thing besides food is sleep. And
So
huge thing
important.
that impacts integrative health, I'm certain is a massive component of what you talk with your patients about. Tell us about sleep and how that impacts mental health.
It really impacts everything. If you're not sleeping, your mental health is going to be affected at some point, right?
Your physical health.
Absolutely. All of them. If you, both of them, if you think about it, an average adult should sleep, say, 8 hours a night, right?
Okay.
Well, there's 24 hours in a day. That's a third of our life. Our bodies and minds are shutting down. That's why would that happen? There's a reason, right? By design, there's a
Absolute
reason.
purpose behind it.
Yeah. So it's almost like a restorative reboot is kind of how I think about it. You know, when your computer is not working and you can't figure it out, what's the first thing you're always supposed to do? Power it off. Right? And then power it back on. So there's things that are happening. Our immune system is getting kind of reorganizing throughout the night, you know, like your brain is categorizing all the things you learned throughout the day. And then are these little cells we used to think didn't do anything, but they're called glial cells. They actually have a role. They run around and they're kind of like, I think of them like this little, is it the scrub daddy? That little,
Yes.
like going around in the brain and cleaning up the neurotoxins throughout the day. And so it is, rest is what I call it. And it's absolutely necessary for mental health.
And frequently when people have trouble sleeping, they might go and get a prescription to help them fall asleep. I would guess that's part of what you're assessing with your patients.
Yeah, absolutely.
What are maybe additional tools or perhaps even instead of a medication, ways to help you fall and stay asleep?
Yeah, so it again depends upon the person. Is it the onset is the trouble? Is it they're waking up in the night? Is it because they have disordered sleep disorder and they're snoring and having sleep apnea? So there's a lot of assessment that goes into it. I would say, things to think about there are supplements that can be useful, and there are also botanicals. So we call it botanical medicine, which is like, plants that have been used for thousands of years. And my job is to sort of look at the individual and find out, is this appropriate for this person based on their age? Okay. Is there data for it? What's the safety, most importantly? And how are they feeling? So there are definitely things. And of course, the mind-body skills are fabulous in addition to sleep hygiene, which people know, but I feel like it's never helpful if I just tell you what you should do. Like a lot of times I read other provider notes and it's like sleep hygiene reviewed, no screens this much time before bed and dark and cool and all the things. Have the same thing that you do every 30 to 60 minutes before bed. Yes, that's all accurate. And if you just tell people what to do, they're going to leave your office and guess how likely they're going to do it.
Right.
Not.
Right.
So instead, I say, what might you be willing to work on? Are you willing to give up a little bit of screen time? Maybe it's 10 minutes. What are we going to swap that out for? Maybe it's gratitude journaling, And so it's really kind of, you have to make these small changes that are rooted in what somebody finds important to them. And then you're going to try to understand, well, why would it be important to them to get more sleep or better quality sleep?
Yes.
Maybe because they want to perform better in their play, whatever it might be. But you're going to harness that to their advantage and then make small changes so they're sustainable long term.
Yeah, that makes so much sense.
Which is so important.
You have a business, Melissa.
I do.
Will you tell us about it?
Yes. So it's called Wellnest, Integrative Pediatric Health and Wellbeing. And it is just a small little private practice. I have the honor of working with my very close friend, Lori Geddes, through Integrative Behavioral Health Services. And we are literally housed in St. Paul in a practice called Down to Earth Therapy. It is a very cozy, comfortable, very beautifully curated house on Selby Avenue that has many different therapists in it. And so it is a place that is non-clinical feeling. And so I have private practice there. I accept presently, which is important for accessibility reasons, 3 insurances, Blue Cross Blue Shield of Minnesota, Health Partners, and Aetna. The others are in the works. So stay tuned. You can find me on www.wellnest, STP for St. Paul.com.
Okay. And what ages do you work with?
Less than 21 and under, typically.
Okay. So this might be if listeners have a child or person who they're caregiving for, they can find you online. And do they just reach out that way to get a hold of you?
Yeah, there is a book an appointment on there. Click that. It'll take you to this other place where you fill out a contact form, and then our administrative team will reach out to get things rolling.
What a great area.
Yeah. How fast can you see people?
So typically right now about, within 2 to 4 weeks.
Okay. And how long could people think that they might be seeing you for?
That's a great question.
Yeah, it is a very good question. I would say typically the least amount of time is probably less than 6 months. I would say what's very interesting is typically when the health goals have been achieved, either people want to continue to come or they come back later because they're like, now I'm having difficulties with this. Could you help me with this?
Sure. Because of course also kids keep growing.
Yeah.
Right.
And and the mind-body connection doesn't stop.
No.
We don't fall into a place of all of a sudden knowing all the knowing about us because we keep changing as human beings. So I could totally see how either a new issue might pop up and that someone would say, well, this same skill isn't working now. I need something else. Or it's a brand new thing that they might need help with.
Well, and their bodies are constantly growing.
Rapidly
at
changing.
every developmental stage. So there'll always be something new for you to explore.
Yes, absolutely.
There's so much to think about here. Thank you for all of your wisdom and insight in this, Melissa. We're going to head to a commercial break. But when we come back, we will talk through all of your questions, listeners, about integrative healthcare. Feels Out Loud will process your questions and thoughts in just a moment.
All you got to do now, express yourself. Nothing to lose. In a world full of strangers, you don't know who to trust. All you see is danger.
We are back again with Feels Out Loud, and this part of the show is where we talk through questions from you all, our beautiful listeners. If you have a question related to mental wellness, sharing feelings, or topics for each week that you would like us to process through, please visit our website at becomingtogethermn.com and find the Feels Out Loud page to submit a question directly. Or feel free to email us at contact@becomingtogethermn.com. We truly want to hear from you and what you are wondering about.
Okay, listeners, thank you for sending in questions and comments about integrative health. You asked so many great things, and we narrowed it down to a couple for us to ask you, Melissa. And
Perfect.
First listener says, there seem to be so many options with integrative healthcare. Where do I even start in finding what might work for me?
Yeah, so you're right. I think this is, again, where it really helps to have somebody on your team. You know, the data would say 35 to 50% of individuals don't actually report that they're utilizing healthcare or holistic strategies to their healthcare provider. What does that mean?
Wow.
They are turning to their social network and social media
Okay.
for answers. And I think, you know, that's important for us to know because it behooves people to know, like, number one, is that the right thing for you? Is it effective?
Yeah.
Is it safe? Or
Yeah.
is it legit? Or are you just spending a bunch of money that you're going to be peeing out, for instance, if you're taking a certain
Literally,
supplement?
yeah.
Right, literally. You know, and having somebody on your team to feel encouraged, have an accountability partner, is really, really important. But where do you begin? If you can't really, like, commit to working with a trained practitioner, I would say it's by reflecting.
Okay.
What's important to you right here in this moment? What do you want to prioritize? And pick one really simple thing.
Yeah. And I love that because that's very tangible. We talked about noticing, and that leads actually to this, what our second listener asked even. They ask, is there a simple way to invest in myself via integrative healthcare? They wondered specifically about the impact of activity.
Yeah. So activity I like to reframe as meaningful movement. And that's because, you know, to me, when somebody says, let's go to the gym and exercise, I think, wah, wah. No thanks. Now, if you say to me, my girlfriend says, hey, can we take a walk? It's beautiful out. Yes, let's do that. Or with my partner, you know, going bouldering or going on a bicycle ride. So doing a hobby in which you are moving your body or moving your body when you're connecting with somebody you care about, right? There's a couple of things that are happening from a mental health perspective. One, if you're connecting with somebody, you're releasing oxytocin. That's our love or connection hormone, and that's really important, right? It also, again, that accountability factor. If you have a plan to meet up with somebody, you're more likely going to move your body if that person's counting on you.
That's a great point.
That makes so much sense to me for people who might be listening to say, what's an easy or simple way to start investing in myself? Think about what you're already doing. And what are you already doing? And what is a way to do that thing involving, as you say, meaningful movement? So if you're already going to see a friend, if you're already making plans, you're kind of talking about that 2-for-1 type thing.
Yeah.
Where
the secondary gain. What is the other part that is going to fuel you to want to do this?
Yes.
Not the have to. Rephrase, right? What am I going to gain from this as opposed to, you know, I have to do this.
Such an important reframe.
Because then it isn't so much another thing you're adding, which is, my guess, some of the apprehension or not doing for people, they say, I don't have the time to, I can't include another thing. That feels like an added weight or stressor. And you're saying the simplest thing is to think about what's already occurring in your life.
Yep.
I totally love that. And parents could challenge their kids. If this is asking kids, what are you already doing? What's another way to do that? Mm-hmm. Well, this has been such a great show. We're already at the end for today. Thank you for listening, everybody, this morning. I want you to join us next week as we talk through school transitions. And in the week ahead, be kind to yourself. Remember that connection fosters wellness. And people, your voice is one that the world around you needs to hear. Share yourselves, friends.
Some do, some don't, some will, some won't. I wanna feel just